Hello and welcome back to my channel, Penny Prepper. Today's video, we're going to be discussing difficulty breathing. This is going to be part of my new series, Medical Minute. So if you're going to be interested in that, go ahead, like and subscribe now, and you should be able to catch the rest of my videos. I will also be making these part of a series that I will make a subscription list for. So if at the end of all these videos you want to check them all out, go ahead and do that. So as I said, we're going to be talking about difficulty breathing, shortness of breath, or also I'm going to be touching on trauma to the lungs. I know what most of you came here for, and that's going to be the trauma aspect. So I'm going to drop a timestamp in here that actually says trauma. So you can skip ahead to that if you want to learn more about the trauma aspects of shortness of breath. So if you're into any of those, stay tuned. But really, it's essentially boiled down to your ABCs, which is your airway, your breathing, your circulation. Your airway and breathing they're sort of in the same category, but really it's about getting air into the lungs and then having effective breathing, as well as circulation that comes later. But really the airway and breathing are the most important part of our medical triad there, where if you don't have airway, breathing, or circulation, the person is not going to make it. So that's why I chose this one to be the first video, because breathing is the most important. Having a proper airway and being able to breathe is the most important part of any medical situation. Here I've actually attached a picture of myself when I was an EMT. This is an example of a nasal airway. Yes, it did hurt. Typically you do these on people that don't have proper breathing or don't have a proper airway. There's also hard oral airways, but this is just an example. This would not be something you would learn how to do. And like I said, it is the most important. What I mean by that is if somebody is decapitated, we'll say, obviously they're not going to have a proper airway or be able to breathe, so there's no use in doing anything there. However, let's say that they have fallen and they have severe trauma. If you are treating the trauma before the airway, let's say that they have a blockage, it doesn't matter how much of the trauma you're able to fix. If they're not able to breathe, they're not going to survive. So that needs to be your first and number one priority after the next most important part. Now, I definitely would have got in trouble if I would have missed the most important part of any medical situation, which is going to be your scene safety, making sure that you are safe, because you don't do that person any good if you get on scene and you do not get there in a safe manner, first of all, and then when you're on scene, if you proceed right in, you have tunnel vision, and you become a victim, then the next person that comes in, hopefully they don't have that sense, but now they have to assist two victims instead of one like you should have done. I'm going to be talking a little faster in this video because there is a lot that I would have to cover, trying to get this done as quick as possible. But after the scene safety, making sure that you have gloves, depending on what's going on, you have proper safety equipment. The next most important thing is the general assessment of the scene as well as the patient. You can do both of those at the same time. See what may have caused whatever issue they're having, as well as get a general overall impression of them when you're far away. That's typically the best way to do it, is getting a general picture of what's going on. And then when you get up to them and start trying to talk to them, you get a more specific idea of what's going on. Once you go up to them, you start talking to them, it's going to be pretty quickly apparent what their chief complaint or your general impression of them is going to be. First and foremost, you want to make sure that you check the ABCs, their airway. Is there a blockage? Are they showing that they can't breathe? Maybe they're choking. Do they have a swelling of the lips? Are their lips blue, or do they look flush? Something like that. Maybe a medical ID bracelet, something like that. These are things that you're going to be looking at as you first come up to them before they even say anything, if they can. Then to see if they are breathing. Are they breathing fast, too slow? Does it look labored? Are they hunched over? Are their lips pursed together? You know, you really need to look at all these things as you're coming up to them, but it's going to be pretty apparent pretty quickly what the issue is. Most of the time, it's gonna be very evident within a couple seconds what their chief complaint is. All right, so right off the bat, it took me a while to explain, but honestly, in the real world, that would only take maybe 10 to 20 seconds to really size up and figure out. And we have all these acronyms, all these fancy terms, but really it's common sense. It's walking up and looking at the person and being like, oh, you don't look so hot. You're going to need some medical attention. And they're probably going to be pretty quick to take you up on that. So the next thing, I know I brought it up in one of my other videos, is sample. It's going to be signs and symptoms, allergies, medication, past medical history, last oral intake, and events leading up to the incident. So we're going to break that down right here. Starting off with signs and symptoms, you're probably going to either hear or you're going to be able to tell before you get up there. You may hear choking, you may hear coughing, you may hear them frantically running around. You may even hear some wheezing as you walk up to them. But really there are a ton of reasons why somebody could have shortness of breath, which I will run through here right now. I don't want to use all the fancy terms, so I'm just going to say plain English. We're going to have choking, we're going to have allergic reactions. Could be the position of their neck. Maybe say they were unconscious and they are leaning on their air pipe. Lack of oxygen in the atmosphere. Maybe say they are not in an oxygen-rich environment, or it's oxygen deficient, or maybe there's carbon monoxide issues. They could also have COPD or chronic breathing issues or lung issues. Also, there's things like pulmonary embolism. The easiest way to put that is a blockage in the lung or clot. A clot would be the easiest way to put that in the lung, which is making it hard for the lung to get oxygen and or bring it around the body. Basically, blood clots stop blood flow. Also, there's things like pneumonia, bronchitis, which typically will be accompanied by a fever. Right into the trauma. This is what I know most of you came here for. So we're going to be talking about things like pneumothorax, which is air in the lung cavity causing the lungs to collapse, penetrating thoracic trauma, and diaphragm issues. Basically, these are all caused by traumatic injuries, and there are some things that you can do in the field to assist. Now, there's not going to be a whole lot of examples I can give you because my lungs are on the inside, but I will try to paint a visual if I can. So first we're going to deal with pneumothorax. So basically that would be some sort of injury where you have a hole that goes into your lung cavity. So your lung is basically like these bags that have smaller bags in them. And what you're dealing with is as air comes in from the outside into your body, into the lung cavity, your lung actually gets pushed up and down on the bottom by the diaphragm. So as that muscle pushes up against your lungs, you breathe out, and as it comes down, your lungs fill back up, you're taking a breath in. Basically having a hole that goes from the outside right into that lung cavity sort of defeats that purpose. Your diaphragm may be trying to relax and pull in air. However, you're not going to be able to get any air into the lung because that pressure in the lung cavity is pushing against it. So it's already basically pushing all the air out. So you can't get any new air in, and that is going to be an issue pretty quick because your lung collapses in on itself like a balloon. Think of it as a giant balloon or bag. And basically, if you have somebody else pushing on that, it's gonna lose its air and turn into a floppy piece of rubber, and that doesn't do you any good. Also, getting the air out, that's something that it's going to take a little bit. Basically, the ways that you can do that is covering that hole with, you can actually take some cellophane. There's a way to do it basically by having one of the sides untaped. So whenever you breathe in, it sticks to the wound. It doesn't let air in, and as you breathe out, it pushes that air out of the chest cavity. A lot of times you'll see stuff like that with gunshot wounds where people have a bullet go in through their lung cavity, and then they need to, if you ever watch the movie Three Kings, I believe it is, they have a great example in there of exactly this type of scenario. I don't have a good way to visualize it, but if you're able to watch that movie, you will understand exactly what I'm talking about. Also, if you have an injury to the diaphragm, which is the muscle that controls the basically the pressure of causing your lungs to expand and contract, if you lose the ability to control that muscle, such as if somebody breaks their back and they sever their spinal cord, depending on what level it's at, if it is above the diaphragm, they won't be able to breathe. They may just look at you and not be able to say anything because they can't force air out to talk, and it's very unfortunate. But really, it's one of those things where if there's a traumatic injury to the back, that's something you need to look out for. And again, this is way above basic stuff, some of the stuff I'm talking about. For the majority of it, anybody here that is dealing with somebody having shortness of breath, it's typically going to be an asthma attack or anxiety attack or allergies, COPD. However, I am going to touch on a little bit of this stuff just to see how many people out there actually want to learn about the extended parts. If you do, drop a comment, let me know, and I will try to go into more detail on this stuff. However, it's a lot of information, and it is going to be something where you're not going to be an expert by listening to me. All right, so back to the boring medical part. We're going to be talking about the signs and symptoms of shortness of breath. First thing that you're going to be doing on the general assessment, looking at them, is going to be looking at the mouth. Is there phlegm? Take a look at their skin. Is there redness? Is there swelling? Also the color of the lips and skin. Do they look pale? Do they have a bluish hue to the lips? Also looking to see if they do have those pursed lips. Do they have noisy or wheezing when they're breathing? Noisy breathing or wheezing when they're breathing. Also, are they coughing? Do they have any hives, rashes? Do they appear to be itching? Do they have their hands up to their neck, showing the common choking sign? Basically, one of the other things that you're going to have to worry about if somebody is experiencing shortness of breath is, depending on how far into it they may start to become frantic and erratic. Panic will start to set in, especially if that airway does close or it's to the point where they aren't able to get enough air in. They're going to start panicking, and they very well may become, how do I put this, a little bit violent. They don't mean to be, but they can't help it. They're going to try to maybe grab at you, sort of like when somebody starts drowning, and they end up pulling down the person that is there to try to save them. The next two are sort of going to go hand in hand as far as the breathing issues go. Allergies, medication, that's going to be a huge part, but again, these two are going to be a little combined. Do they have a rescue inhaler or use albuterol? Do they take a daily inhaler for long-term breathing issues? Do they have a treatment of some sort, medication? Also, the medication that they do have, which is the next part, A&M, is going to be very valuable. Do they maybe have a bracelet on that says that they have a certain type of allergy? Do they have an EpiPen with them? Typically, if somebody's having an allergic reaction and they have their EpiPen with them, they will grab it as soon as they can. However, sometimes they may lose consciousness and they may still have it near them if they're not able to do it themselves. As an EMT, you are not allowed to grab a regular EpiPen and just jab somebody. For the general population, if they have their EpiPen and they pass out, I'm not going to tell you that you can do that, but I don't think that you will get sued if you use their EpiPen for them. As an EMT, you were supposed to assist them in utilizing theirs. Half the time, if it got to the point where you were there and they were having a severe allergic reaction, they may be passed out. So that's not always a viable option. Past medical history, the P, that's going to be one of those things where if they're able to tell you that they have an allergy or, hey, I got stung by a bee, I'm allergic to bees, that's great. Chances are they won't be able to tell you if it's that severe, or they will be able to tell you that they use their EpiPen. This is for a regular civilian, not an EMT. So their past medical history, they'll typically tell you if they can. If they're not able to tell you, whatever, that's something that hopefully they have a medical alert bracelet, or they have somebody there that knows them well enough to tell you. And hopefully they will know what to actually do for them if they know them well enough. All right, the last two, again, are sort of combined a little bit. The last oral intake and the events leading up to the incident, I sort of combine those two because if somebody says, oh, I just ate a handful of nuts and I'm allergic to nuts, and then I got stung by a bee, those two things sort of tie in together. If they say, oh, I just drank water, or some person says they just drank water, that was it, and then they say, I don't know what happened after that, or you don't know what happened prior, there's not really a whole lot you can really do with that information. It has to be specific. All right, as I said before, unless you have further medical knowledge or you have an expertise in breathing issues, unless the person has medication like a rescue inhaler or it is a traumatic injury which you are able to treat, as far as COPD issues go, there is medication for that. But again, if the person doesn't have their medication or you're not trained or know how to treat that, the outcome may be less than ideal. All right, so that was the first installation of the Medical Minute. If there's any parts of it that you would like to see or more information, please let me know. That's all we have for today. Please comment, share, let me know. Stay safe, stay prepared.